Hi, I'm Chris Duell, and welcome to Scitech Now, our weekly program bringing you the latest breakthroughs in science, technology, and innovation. On today's episode, 3D printed injectable devices, saving the sacred Navajo water, the world's most powerful rocket, and habitat replication. Let's get started. Research is being done inside a UTSA laboratory to develop a 3D printer injectable device that can deliver medication inside tumors and other parts of the body. We go inside the lab to find out more.
This particular system, as opposed to being an oral capsule that a patient swallows, is an implantable. A lot of people are a little worried about implants, though the IUD market and a lot of the other implantables that have become more and more common, the average patient's becoming more comfortable with the idea. These implants, as opposed to a large thing that we're going to cut open and slip in, is a micro implant, or miniature. It's in the millimeter scale. So it can be delivered through a needle stick, just like a flu shot.
Size is really important in some of the designs that we're going for because we want it to be able to be injected, so we don't have to have an invasive surgery. We can just go in with a syringe and inject it that way. And B, because some of the drugs we're delivering don't necessarily take a very large dosage. If we're going to deliver to a cancer tumor, then the size doesn't need to be very big because the therapeutics are pretty concentrated and they don't need to be very large volume.
So the scale that we want has to be injectable, which is why we're making them so small. We're hoping to get them down to about like 1 by 3 millimeters. Injectable sizes can go up to 2 to 3 millimeters in diameter as well. If the device itself is 1 by 3 millimeters, then we have to make the composite structures inside even smaller.
So pretty much what you're looking at here is we're actually creating a 3 by 3 millimeter cylinder. So if you see right here, this is just pretty much the inside structure of how it's being filled in the inside, which will play an important role on as far as the drug delivery as well. So with this software, we can actually change the way that it's filled to actually alter different parameters as well. So some of the changes that I found to be very, very important is, for instance, the pressure, the temperature as well, which is here. We're at 130 degrees Celsius for our PCL, which is polycaprolactone. So that's another thing, as far as the layer height as well. So we wanted to have a very fine resolution when it's inside of the body as well. So pressure, the speed, there are quite a few variables that you can change to get the perfect print. So right here, we're actually on layer 31 of 32. So this is pretty much, this software allows me to control everything that's going on over here with the 3D printer. So if I click continue printing, then we'll print our last layer, and then we have our 3 by 3 millimeter size particle ready to go. So what we'll do is we'll take this powder here, which is the polycaprolactone, and we'll actually place it inside of the chamber, which is here. So we place it inside of the chamber and allow it to melt. And then once it's fully melted, then we'll go ahead and start printing. So one of the main reasons that we have this fan here is because our PCL, the polycaprolactone that's located in the inside, it doesn't cool fast enough. So if we can get it to cool fast enough, then we can print on top of the next layer. So that's why this fan is located here as well. I can actually print this print in roughly 15 to 20 minutes. Actually, you can print it faster, but with the properties of PCL, you want to make sure you kind of let it take its time to cool and things of that nature.
So these are on the millimeter scale. We're trying to get them to be 1 by 3 millimeters up to 2 to 3 millimeters in diameter at the most. So they're going to be really small because we plan to inject them. So in order to inject them, they need to be at a very small scale. And if you just want to compare it to a penny, let me put the penny right next to it right there, so you can compare the size.
The pharmaceutical industry is coming out with new drugs constantly, and then they're making incremental improvements to a drug, and then there's a breakthrough drug that's this blockbuster that runs away. That's happening so fast that an academic research lab wouldn't be able to, say, optimize a system for today's big drug because tomorrow there's another one. Now this system is drug agnostic, and by that we mean that it can be used to deliver nearly any drug. So this system, as the pharmaceutical industry continues to push those boundaries, our system can be used to deliver whatever the new flavor of the week is in what's being developed in drug discovery.